Good evening. As we convene here virtually tonight, we are reminded of the challenges that are faced and poised by COVID-19, as well as how this pandemic has underscored pre-existing underlying inequalities, such as gender inequality and as well racial inequality. Tonight, we also remember the lives that have been lost, not only to COVID, but also to racial injustice, including but not limited to George Floyd, Ahmaud Arbery, and Breonna Taylor. Right now, we would like to convene a brief moment of silence to remember those who've lost their lives both to disease and racial injustice. Thank you for that. Today, our voice is standing alongside the most marginalized, the most vulnerable, the most disenfranchised. This action can make a change, and we will never underestimate the power of one voice. With that faith, I share this poem with you entitled Fight with Care. What does it mean to fight with care for a better world? Around us, a battle whirls to save lives and to end poverty. In the fight, we have the most audacious impact in how we act for women and girls, giving volume to their vital voices so they are entitled to their own choices. In women, we see not victims, but victors, the most powerful predictors of progress that will be determined by women who will not rest. Care works around the clock, around the block, around the globe for that woman wherever we can find her, opening doors not just for her, but all the people behind her. We are committed to social justice, to hope, and to human dignity. We work with affection and affinity for those living in poverty. We believe in freeing every human being with urgent action, transformation across nations, within ourselves, in this very organization. We put women at the center, for if you empower one girl, nothing can prevent her from safety and security, freedom and futurity, openings and opportunity, not just for herself, but her country and community. We respect a woman not just because we list her as someone's sister, daughter, or wife, but because she is human, because she is alive. So just as you know the wind, not by where it begins, but by where it's blowing, just so you judge the tide, not by where it resides, but where it is going. These currents too rent the skies. When one woman tries and one woman defies with her rallying cries, we are leading the way. Not so that our impact is acknowledged or tallied, but because it's our calling to rally with a headstrong heart. For fighting with care means to take part in the work simply because there is always work to be done, always a valley and a hill we will overcome. From around the world we come, forces for fairness and freedom in this lifelong belief we share. To always come together, to always fight with care, not just for a better world, but for the brave woman who will get us there. Thank you.
Thank you so much to our incredible youth poet laureate, Amanda Gorman, for starting our conversation with such grace and with power and helping us begin with the affirmation that Black Lives Matter as well. So I want to thank everyone for tuning in. I'm Michelle Nunn. I'm the president and CEO of CARE, and I'm honored to have you with us today. These are incredibly challenging, difficult times. We find ourselves fighting three battles against three formidable enemies: a global pandemic, rising poverty and hunger, and entrenched racial injustice and inequalities. I recognize these battles are daunting, but now is the time to fight harder with compassion and with creativity and with fierce determination. So thank you for reaffirming your commitment to CARE and the critical work that we do in 100 countries to reach over 70 million people each year. Our work has never been more important than it is right now, today. With economies shuttered around the world, there's a real possibility that more than 500 million people will slip back into deep poverty. This pandemic lays bare existing inequities, harshly impacting those who are already marginalized and vulnerable. The pandemic is having a disproportionate impact on women and girls, who provide 70% of the world's care. What this crisis requires is a global response on a massive scale that demands the voices of women leaders are heard. To ensure the health, safety, and recovery of our families and communities, we must look to women leaders. We must make women equal. As we face the challenges of both the global pandemic and systemic racism in the US, CARE will stand alongside the most marginalized people to build back a more just and equal world. We know women's leadership, coupled with their resiliency and capacity for change making, are critical to this vision. An important update on today's summit: while we do plan to keep our discussion focused on the global response to COVID-19, our conversations will not ignore the broader harm that structural racism continues to cause in our country and globally. As CARE's poverty fighting work extends into US communities for the first time, we remember that in order to be anti-poverty, we must also be anti-racist. We have a powerhouse lineup of speakers. I see thousands of you already that are active on the chat in the discussion topics. I hope you will stay with us and that you will leave informed and inspired and ready to act. In fact, let's get started with some action. CARE has a petition asking Congress to provide at least $12 billion for a global COVID response. Each time a person signs, 3 letters are sent. So we hope you'll help us reach a goal to send 15,000 letters to Congress by the end of this summit. Signing the petition is easy. You visit care.org/fightcovid or go to Act Now in the app or web browser. If you have additional questions, please join the online chat and connect to one of our CARE staff. So I also want to thank all of our supporters who've donated to fuel our work and to advocate to advance our mission. You make our work possible every day, and it has never been more important. So let me share some specific thank yous to some of our corporate partners. I want to thank MasterCard for supporting our delivery of care package gift cards at this critical time. And this event would not be possible without the generous support and partnership of Delta Airlines, UPS, P&G, Cargill, and the Eleanor Crook Foundation. And speaking of our longtime and extraordinary partner, UPS, take a look at some of their great work and then hear from CARE's global advocate, Aman.
The COVID-19 pandemic has had a devastating impact on America and the world. Lives have been lost, many have lost their jobs, and in this time of great uncertainty, the distance between one another has never felt further. However, essential workers on the front line of this crisis are risking their own health to deliver the items we need to keep us safe and connected. UPS has been a leading partner in CARE's life-saving work since 1995. Today, CARE is proud to honor UPS worker Toy Ann McCrae. In times of crisis, we are told to look for the helpers. Toy Ann McCrae is a helper. She has served the greater Chicago area for more than 30 years. While being a mother, Toy Ann worked a full-time job while going to school to finish her degree. It's a story that has given hope to the thousands who have heard it. Whether it's serving hot meals at a local shelter, volunteering at the Special Olympics, collecting feminine products and toiletries for underserved women, or mentoring youth in juvenile detention, Toy Ann's impact is felt wide and far.
We've given chili, sandwiches, snacks, and love.
To Toy Ann.
Hi, I'm Iman, CARE's global advocate. The COVID-19 pandemic is unlike anything we have ever seen before. For the world's most vulnerable, it threatens decades of progress. That is why we're here today. This pandemic threatens to worsen gender inequality, especially among girls and women living in poverty, and especially living in refugee settings. I know this firsthand because I am a refugee. In 1972, in the middle of the night, my parents woke us up, we got into a van and drove to the border of Kenya and became instantly refugees. I was 16 years old. If it was not for the NGO like CARE, I don't know what my trajectory would have been. Today, there are 17 million refugees in the world. These are people with hopes, lives, and dreams. They have survived natural disasters, wars, traumas. They're living in places where people cannot get critical supplies like food, clean water, medical services, and they cannot practice social distancing. In time of emergencies, women and girls become too often targets of sexual abuse, domestic violence, and child marriage. CARE is responding to the crisis right now by providing water, soap, food, and critical messages to help stop the spread of COVID-19. And CARE is relaunching the iconic CARE package and bringing Americans together to save lives and empower women and girls everywhere. This pandemic requires a global response, and in this response, it requires all women leaders to be heard. We must make women equal.
Hello. Hi. Not sure if we're supposed to start now.
Hi, Grace.
Hi, Susan. Hello. Hello, CARE audience. My name is Anya Manuel, and I am most importantly a member of the Global Advisory Council of CARE, and also a former State Department official, and now business partners with Condoleezza Rice and others in a consulting firm. We are honored to have with us today Congresswoman Susan Brooks from Indiana, Congresswoman
Hello.
Grace Meng from New York. And these two women are global champions in the fight for women and girls. CARE works around the world to help women and girls, and we're going to jump right in to a very difficult, complex topic. Gender-based violence is increasing as a result of this pandemic, both in the United States and around the world. Home isn't always a safe be during quarantine. Congresswoman Meng, who's with us today, introduced the bipartisan Safe from the Start Act in the House, and Congresswoman Brooks has co-sponsored it. The bill importantly directs the Department of State to use their humanitarian assistance, ideally to prevent gender-based violence, but also to respond to it when it happens as part of an emergency. So I'd like to ask you two leaders in this space, I'd like you to start with more of a personal question. What is it that inspires you to speak up for women and girls around the world?
Do you care who goes first?
Go ahead.
I can go first. Yeah, thank you,
We'll
Anya.
start with
And
you.
it's great to be with my colleague, Congresswoman Susan Brooks. It's an honor to serve with you. And during this COVID-19 pandemic, we haven't been in Washington as much, so I do miss you and so many of our colleagues. I hope that everyone is safe and healthy, and I'm so thankful to CARE for this opportunity. You know, a lot of these stories, they're personal. You know, we can read about it, and in my role as a member of the Foreign Affairs Committee previously, and now on the Appropriations State and Foreign Ops Committee, we've learned a lot about these issues, but we also have heard personal stories and testimonies from girls and women all around the world. And the more I learn, you know, whether they are topics of menstrual equity, to the role of youth and peace processes, to the tremendous risk every day that girls and women face in, especially in emergency humanitarian settings, we've learned most from the brave women and girls who've been able to come forward and share their stories with us so that we can be empowered to help others.
Thank you. Congresswoman Brooks, I know you went on a trip to Guatemala with CARE, and that was one of the things that encouraged you to get active. Could you tell us a bit about that?
Thank you. I actually wore my Learning Tours t-shirt tonight. And I have to tell you, I was so pleased because one of the women that was shown on your screens was Sandra. There she is. Sandra Kichin from Guatemala, who I had the beautiful, wonderful opportunity to meet and to become friends with. She inspired me. This is a young woman who could not, who inherited a small piece of land, but yet she did not have any funding in her community in order to move forward to buy. She wanted to become a farmer. Her young husband said women aren't farmers, but she really wanted to become a farmer. And it was because of CARE and a program that they gave her the tools and the training and some financial resources and backing. And now Sandra is the leader of the largest women's cooperative in Guatemala. She employs about 500 women farmers work together. If you buy vegetables from Trader Joe's, you're buying some of her vegetables, about 1,500 farm workers. And then we went and saw an incredible processing facility that was immaculate, that was wonderful, and saw about 900, learned that about 900 more women were working. That is empowerment. That is leadership. That's a tool that CARE provided. And Sandra has been a voice for so many women who were told she couldn't do any of these things. She didn't have the status, didn't have the means, didn't have the background or the training. And so she truly has inspired me and so many people.
That's wonderful. Thank you so much for sharing those personal stories. Now, say a little more. You're both legislators. It's hard to get anything done in the US Congress these days, yet you're fighting. What is it that legislation can do to help on this issue?
I'll let Grace start, since she's the one who really brought, Grace is my neighbor. We don't get to see each other much in the Rayburn halls anymore, but Grace is the one that really came up with this bill, say from the start. So I'm going to let Grace explain it. You'll completely, I hope, understand why I'm supporting it.
Yeah, thanks for the question. I mean, this issue, like with so many others on Capitol Hill, has been bipartisan from the very beginning. We are a bipartisan group of House members and senators who truly care and want to prioritize this issue of physical safety for girls and for women. And this bill really simply just codifies the important work that the humanitarian community and our leaders, like those in care, are already doing every single day, without providing and guaranteeing physical safety for girls, for women. We can't even begin yet to talk about increasing access to education, funding, like Congresswoman Brooks mentioned, for those who want to start and expand their own businesses. And we can't even get to, increasing access to civic and political participation to improve their communities. So we think bills like this are just really common sense. We want to make sure we're doing what we can to protect the safety.
Anja, we want to make sure that, especially during times of crisis like COVID, that USAID and the State Department, with the funding that we provide other countries, that those other countries have strategies around gender-based violence, that they prioritize gender-based violence, particularly during these times of crisis. Home is actually not the safest place for so many women and children, whether it is through, acts of domestic violence, child abuse, and so forth. And with the inability to leave the home, we have to find more and more ways to communicate and to help women-serving organizations make sure they're thinking about what women and children, but women primarily, are experiencing during shut-ins, during times when there are curfews, during times when they can't have contact with the outside world. It's a very, very difficult time for women and girls.
Boy, you're absolutely right. And understandably, here in the US, we have been focused on what's going on domestically, but I know CARE is working in Ecuador with our local partners to host virtual events on Zoom to make people aware of this issue. We're doing it in Honduras. We're doing it in lots of other places. And it takes a coalition like this, leaders like you in Congress to help, folks on the outside in the NGO community to push it, and then the local governments where we're working. So what do you think the chances are that this bill will get through in this difficult time for bipartisanship?
Well, we are very hopeful. I think, honestly, the one thing that I've noticed since coming to Congress is that we are able to work on many issues and many pieces of legislation together in a bipartisan way. And we've been able to pass legislation that makes sense. This is legislation that makes sense. Just a few months ago, the House passed legislation to make sure that refugees could use Senate, facilities safely. So this is something that there is bipartisan support for.
Great. It's an important issue.
I definitely think that there would be members on both sides of the aisle are looking for more and more ways to, I think, show the American people that our government can work and that we can reach agreement on so many issues. We have on a lot of issues around COVID. We've come together on quite a few. I think this is certainly one of those areas that I suspect, and with Grace's leadership, I think we'll get a lot of things moving on this bill.
Boy, well, thank you both for your leadership and everything you're doing on this. I know we have a question from an audience member, from Tiffany Tyler in Indiana. Please go ahead if you're on the line. Hi, Tiffany.
Hi, yeah, I'm Tiffany. I'm from Indiana's 5th Congressional District. And my question is, how can we all work together to bring gender-based violence issues out of the shadows so that they can be discussed at the forefront of policy responses to COVID?
Well, thank you, Tiffany, and hello. I represent the 5th District, so great to have a constituent here on this virtual summit. You know, I think that while we focus on the health and safety of so many really important issues like domestic violence, gender-based violence, and so many other issues kind of fall away because we're so focused on the medical responses and on how government is responding in other ways. But I think because of visits like this, virtual summits like this, we can continue, and with your help and so many others, we need to talk about what's happening to families. We recently in Indianapolis, there was a young African-American female police officer who was shot and killed responding to a domestic violence call. And we know that the calls are up all across the country and across the world because of so much stress, so much anxiety, and so much violence in the home. And so sadly, Officer Brianne Leith was tragically murdered by the perpetrator, but we have to realize that these are opportunities to talk about domestic violence as well.
Congresswoman Meng, do you have anything to add?
Well, I think that how I've become more informed about these important issues, whether domestically or around the world, how I've gotten to work more closely on these issues with amazing partners like CARE, are because of the brave girls and women who are willing to come forth and share their stories. They're willing to be partners with us. They're willing to tell us what's needed on the ground, whether it's with government or legislatively and policy-wise. These personal stories and these folks, they are our true champions and the leaders that are making a difference.
Thank you so much, both of you, for being such leaders in this really important cause, for being partners with CARE, with all the amazing things that this organization is doing around the world for gender-based violence always, but especially in light of this terrible pandemic. And let me just reiterate what Michelle said in the beginning. There's a petition right now. Please sign the CARE petition, and let's make sure that women and girls' safety are front and center as we fight COVID-19. Thank you all very much, and we'll move on with our programming. Thank you.
Thank you. Stay healthy.
Thank you.
Bye-bye.
Thank you, Anya, and for terrific moderation, for being on our advisory council, and to wonderful Congresswomen Brooks and Meng for your leadership and for your bipartisan demonstration of getting things done that make a difference in people's lives, especially around gender-based violence at this critical time. It's my great honor to introduce to you Senator Cory Booker of New Jersey. As a member of the Senate Foreign Relations Committee, he is a leading voice on the importance of the U.S. as a global leader in the fight against extreme poverty. And he's been a longstanding and powerful champion for equality and justice at home and abroad. And we're thrilled to welcome him back to the CARE conference. And we are thrilled and grateful that you're with us here today, Senator. He's muted. Senator, I think you may be muted.
Thank you. I hope that worked.
We can hear you, and we can hear you loud and clear. Thank you so much for being here.
I'm really grateful to be here. I'm excited. I had the privilege of speaking to you all just a couple years ago, I think, and it's amazing to me how in so many ways the world has changed and shaken up, but at the same time, the work you all do is stunningly important in the global context. And I was asked to speak for 5 to 7 minutes, and I would love to, in a strange way, speak to you from the heart, not specifically about the work that you all are doing, but frankly, maybe a little bit more about the things that are going on here in the United States and its impact on the world. This has been a profoundly difficult time, I think, for many Americans to witness the way that this COVID pandemic has so affected our nation, having about 5% of the globe's population, but about 1 out of every 4 of the deaths on the planet are right here in the United States of America. And what has been difficult, I think, for our country is that these deaths have revealed a lot of the fragility within our society and the deep inequities that exist in the United States of America. And whether it's the way we honor our elders and how vulnerable they have been, often in long-term care facilities that were not prepared, where the reporting mechanisms, transparency and oversight wasn't what it should be, or just this disproportionate impact on African Americans dying at twice the rate of the general population, and how the fragility and inequities built within our healthcare system have so unfortunately revealed the deeper inequities within our society. If you add to that the fact that this economic downturn has shown this country's challenges as well when it comes to unmet crises, when it comes to the disparities along racial lines, as African Americans and people of color have found themselves more and more in positions of essential workers, but yet are often treated like expendable workers who are finding themselves more vulnerable and often the first to lose their jobs entirely. The immigrant population in our country as well, often in jobs from meat packing plants to actually harvesting the food, have found themselves with little to no protections in a nation where we so depend upon that work and that labor for our food systems, but yet seem to have been able to afford those individuals little of the supports that we are trying to do for the general population. And then finally, amidst all of this, an economic crisis and a global pandemic, we've been reminded of the inequities when it comes to our criminal justice system, where again, the United States is distinguished in the wrong way. We are the home of the brave, the land of the free, but yet with only 5% of the globe's population, we incarcerate 1 out of every 4 people on the planet Earth, and 1 out of every 3 incarcerated women on the planet Earth are here in the United States of America. And along racial lines, it's stunning. We now are at a point in America where we have more African Americans under criminal supervision, jail, prison, probation, parole, than all the slaves in 1850. And overwhelmingly for nonviolent crimes, overwhelmingly for drug crimes, when we know there's no difference in America between African Americans using drugs or selling drugs than the white population of our country. But African Americans are being incarcerated at 3 to 4 times the rate. This has been difficult because it has all been made all the more clear by how we as a country have seen in these last weeks a young man getting murdered while jogging because of the color of his skin. An awful situation where Breonna Taylor, a woman killed in her sleep because of tactics that are used by police officers. A woman in Central Park threatening to use the police as an instrument of degradation of dignity against a nonviolent man watching birds. And then finally, the brutal torture and murder of Ahmaud Arbery. All of this has shaken our country, has in many ways tilled the soil of our souls, unearthed many of our pain and grievous realities that have been packed in to this nation. And the hope is within all of this that somehow seeds can be planted within us that can grow a harvest of hope, that we are a nation that can change. And as I talk to this organization today, I understand even the word care coming from ideals of compassion and empathy and action for one another, is that folks of privilege should be understanding that their privilege affords responsibility. But even more so, what care does to me is something that is so enlightened, that we know, as Shakespeare said, the quality of mercy is not strained. It sprinkleth from above upon the place beneath. It is twice blessed. Blessed is he who is giving and he who receives. And that is so true. The enlightened self-interest that we seem to be missing in our country, that has caused us to be such a significant police state, is what we're missing. Look, I introduced legislation with allies this week about police accountability, and in many ways it's the most sweeping police accountability bill in the history of our country. But the reality is it's narrow, because the larger issues and values of this organization speak to truths that are global, truths of humanity. Is that when you help vulnerable people, you help society as a whole. We know that we are a country that treats mental illness not with healthcare, but overwhelmingly with police and prisons. We are a nation that treats addiction, arresting the same people over and over and over, costing our society hundreds and hundreds of thousands of dollars per individual, treating them with police and prisons, and not what they really need, which is treatment and care. We have criminalized poverty in this country, as neighborhoods like mine, where I live, where the median income per family is about $14,000 per family as of the last census. We know that people who have warrants out for their arrest for traffic violations, who have to make terrible choices between paying those warrants or a car payment or a rental payment, or as we've seen, lines now for food, often those are food. We have a nation that criminalizes the weak and the vulnerable. If you look at our prisons, as Dostoevsky said, you want to see the state of civilization. Look at a nation's prisons. We are a nation that puts people who are survivors of trauma. Women in our prisons are overwhelmingly 80 to 90% are survivors of sexual trauma, put into environments that compound that trauma by shackling pregnant women, by putting them in positions where they are guarded by folks who do not have trauma-informed care. And so there is a better way to go. We see this in the work that you all do. I can show you studies from all across the country, like Seattle, that found simple study: what's cheaper, to put people who have mental illness, who are homeless on the streets, in supportive housing, which is expensive, or to leave them on the streets. And they found very quickly that it costs so much more to leave them on the streets, because they end up being engaged with police and in hospital emergency rooms or prisons. There is an ideal in our country that is a national and a global ideal: caring, compassion, the seeking of being a more beloved community. These are not just quaint ideals, they're actually vital to the well-being of us all. The United States work internationally has shown what leadership can be about. And I'm a big believer that you cannot lead the people if you don't love the people. Our NGOs and our government doing things to help others on this planet has shown tremendous benefit, not to those we serve alone, but to all of us. Our work with Ebola in the DRC, our work with confronting famine in sub-Saharan Africa, humanitarian assistance everywhere from countries who are engaging with refugees from Syria all the way to the Rohingya. All of these things we know make us all more secure. In a world globally of pandemics, we now understand, I hope, that injustice anywhere is indeed an injustice everywhere. And so as we all go about to support the work of this great organization, I just want to say thank you for your service. Thank you for your efforts. Thank you for understanding that this country, as I travel on the Foreign Relations Committee and I see us having to put so much of our military investments around the planet, the truth is when you deal with instability, when you empower people, when you help with access to food and medicine, you actually lower the need for military engagement, for counterterrorism, and all the things that we seem to be spending so much money on as we begin work here on yet another military budget. So I just want to give you my gratitude for all that you all do. I want to tell you, you inspire me through your work, and I hope that we can continue to expand efforts like yours so that we can actually achieve true peace. As Martin Luther King says, peace is not simply the absence of violence, it's the presence of justice.
Thank you so much, Senator Booker, for speaking to our pain, but also speaking to our values and actions that point us towards hope for the future. Thank you so much for your time.
Thank you very much for having me.
My name is Jada McKenna, and I am the Chief Operating Officer of CARE. And I am pleased to have 3 leaders in global health and development joining us today. I'm also proud to call some of them my former colleagues and friends. Sylvia Burwell is the president of American University, the first woman to serve as the university's president. Sylvia has a long career in public service, including serving as the Health and Human Service Secretary during the Ebola crisis. Mark Dybel serves as the co-director for Global Health Practice and Impact at Georgetown University. Under the George W. Bush administration, Mark led the implementation of the President's Emergency Plan for AIDS Relief, fondly known as PEPFAR. Helene Gale is CEO of Chicago Community Trust, one of the nation's leading community foundations. Helene's long career in public health includes her early work at the CDC on the HIV/AIDS crisis and former role as president and CEO of CARE. Here in the US, the pandemic has exposed weaknesses in our health systems. In countries where CARE works, the health systems are far more fragile and operate at far less capacity. CARE works with frontline workers like Joysna from Bangladesh, who are putting themselves at risk. The lack of transportation and non-cooperation from her community isn't stopping her from serving women to protect them from COVID. Investments must be made to strengthen health systems to protect healthcare workers on the front line of the pandemic, ensure the continuity of healthcare, and safeguard the most vulnerable populations. Steps also need to be taken to prioritize continued access to critical health services, including family planning and maternal health care, and to address hunger and malnutrition. So I turn now towards my panel. You have each led through past global health crises. Starting with you, Mark, what is a critical lesson learned that could be applied to the current pandemic?
Thanks, and great to be with this group. I think it goes, and especially with Sylvia and Helene, who've been friends forever, way too long. It goes without saying for this group, but I think outside of this group, global pandemics require a global response, flat out. But we don't understand that in the United States because we haven't experienced the global pandemics in many ways. Sylvia was a fantastic secretary, and she'll talk about what she had to deal with. But we had H1N1, we had Zika, we've had threats of SARS and MERS, but they never came here. And so we never have felt what we're feeling today, which is the real threat of a global pandemic. And we don't know and understand the need for a global response, something we learned from HIV, TB, and malaria. You need that for a couple of reasons. One, global solidarity. And that solidarity and humanitarian connectedness is more impactful than many people think. Just working together changes the whole dynamic. But secondly, it's just as the senator just said, enlightened self-interest, flat out. Today, there were more infections than at any other time in this pandemic so far. Not in the United States, although we're not doing very well, not in Europe, but in Latin America and Africa. This is what happened in 1918 with the influenza pandemic that killed more than 50 million people, moved to the south, and then came back in a terrible wave. If we don't have control of this pandemic in other parts of the world, we are at risk constantly until the pandemic is quiet throughout the world. No country is safe, no person is safe, as long as this virus is lurking somewhere in the world, because it can break out. We are a connected world. Second major lesson, leadership at every level, but it's got to start at the national level and global level. Global leaders need to be coming together like they did to respond to HIV, TB, and malaria, whether it was PEPFAR in the United States or the Global Fund internationally. Community, no pandemic will be defeated without deep engagement of the community. It's a deep lesson from everything that we know from HIV, TB, and malaria. You cannot dictate from above. Solutions will come from the community. Bill Foege's book, House on Fire, explains in beautiful detail, anyone who cares about it should read this book, about it was the community that led to the end of the smallpox epidemic. You needed the vaccine, but it was the community engagement that changed everything. It's also where community healthcare workers are in, for example, Africa. We have them there because they're used to having Ebola, cholera, HIV, TB, malaria. They have legions of them. We can use them, and they can be very effective. South Africa's already deployed 28,000 of them, more than the United States has deployed. We need that leadership and community for the last lesson. Pandemics hit hardest at the most vulnerable, and discrimination, stigma drive pandemics. It's true in HIV, TB, it's even true in malaria, and it's absolutely true in this, as the senator just talked about, terribly clear in the United States, and it will be clear as well around the world. If we can't get vaccines, if we can't get treatments when they're available, if we can't now intervene to tamp down the epidemic among the most vulnerable, We will pay a price. They will pay a price. But if we all come together, we know we can solve this. The US Congress already appropriated $5 billion for a global response to COVID. We need them to approve another $12 billion. And it's you all listening that can make that happen.
Exactly. Sylvia, can you talk about how public health crises uniquely impact women, and how can we expect it to impact things like access to livelihoods, education, critical reproductive health services?
So absolutely. And I think as we talk about how it uniquely impacts women, I do think we have to recognize that this particular pandemic is also raising the issues that Senator Booker mentioned and Michelle mentioned in the beginning in terms of the issues of race. And so there's some overlap, and I hope we'll get to some of that conversation in terms of the disproportionate impact on communities of color. With regard to women, I want to focus on a couple different areas where around the world, whether in the United States or in the parts of the world that CARE does tremendous work in, it affects. And I want to actually start with women's roles in family and community. Because women's roles in family and community, they are often primary caregivers. And they're primary caregivers for the elderly, which in the COVID-19 situation, there's a disproportionate impact in terms of mortality and morbidity, sickness for people in those age ranges. And those are people that women are caring for. It also has to do in this case with caregiving for children. And around the world, when we take away the support systems that help women care for their children, whether that's schools in the developing world and in the developed world, whether that is the help that they can get coming into their households to help with children, that is harming women more. The second area is in the area of economics. And women are disproportionately impacted in terms of what's happening in this particular pandemic, but in all public health crises, we see women in terms of the unemployment rates. For instance, specifically in this area, women who are involved in the industry of hospitality and tourism, disproportionate numbers of women are going to become unemployed. But economically, women tend to bear a larger brunt. They started in a place that isn't at the same in terms of things like everything from what they're paid to what they can do. And so when you have this economic tension and decline that's occurring, it aggravates that as well. The third area actually is women's health. And women around the world do not receive the same access to healthcare and the same healthcare as men do. And so there's a disproportionate impact when you have something that is causing further health problems. And when you have a disease like COVID-19, which actually impacts people with underlying conditions even more. And so women who haven't had the access to healthcare and have some of those underlying conditions can be impacted more. And I also put the issue of domestic violence in this space too, that has been mentioned as well as something when women are in those settings, when there are crises, when there are stress, those issues are exacerbated too.
Thank you, Sylvia. Helene, we've just heard a lot about the profound impact on society and especially women and girls beyond the disease itself. How can we ensure that there is a holistic response to this crisis that addresses challenges like access to food and malnutrition, the need for better water and sanitation services, building more resilient livelihoods, and giving women and girls the tools to overcome some of these things that Sylvia was speaking of?
Yeah, thanks, Jada. And first, I have to say how excited I am to be part of this. This conference is such a special opportunity because, you know, this is the one time a year that people volunteer and use their voice to make sure that the issues of global poverty, and particularly women and girls living in poverty around the world, are not forgotten. And so it's just wonderful. And as I look down there and see the 800 and some participants, it's pretty thrilling for me to see this. So wonderful to be back with you. You know, I think that we have, in some ways, a real moment of opportunity to actually think about this more holistically. You know, we know that you know, diseases have always impacted economies with HIV and AIDS because it affected those in the most productive years of their life. We know that it had a huge toll on economies, tuberculosis, et cetera. But this is the first pandemic that we actually shut down economies as a result of a public health epidemic. And because of that, we're seeing this twin pandemic of, which is both public health as well as economic. And I think it means that it forces us to think about these broader issues that have always impacted health. We talk a lot about the social determinants of health, the 80% of things that actually have more impact on your health than healthcare itself. Things like access to a income, access to clean water, sanitation, access to affordable food, et cetera. All of these things that we always knew had a huge impact on health. Well, now we have to address them because we've also created an economic challenge that we're going to have to, as a world economy, figure out. And so I hope that as we think about how we develop the things that Mark has talked about in terms of a public health response and the global response that we need to the public health crisis, that we also put the same type of energy into thinking about how do we make this a more equitable economic environment as well, so that those things that actually drive poor health, drive unequal access, also get the same kind of attention in the meantime. So I think we have an opportunity to really figure out how we look at these issues that are so intertwined and look at how we can make this a much more equitable response as we think about the recovery from COVID.
Indeed, we do have to keep our eye on that point around the equitable response. I would like to ask care advocate Dr. Sharman Monaghan of Georgia to join us. She has a question that she would like to ask.
Hello, Helene.
Hi.
Black women in America have unequal access to health care, from maternal health disparities to barriers accessing everyday medical needs. I have personally lost 3 classmates due to maternal mortality. How do we ensure that women of color have equitable access to health care, and how has systemic racism prevented progress?
Yeah, thank you for that question. And Sylvia Burwell alluded to some of this in her comments. We know that, in America, there is very unequal health and very disproportionate access to health services, as well as the things, as I mentioned before, those social determinants of health that also impact people's lives. And a huge issue, you raised the issue of maternal health as an example. Mortality rates in African-American women, pregnant African-American women, maternal mortality are around 3 to 4 times higher than those in white women. And we know that that's both an access issue, but it's also an issue based on these other issues, and racism being a big part of that, and how women are able to access health, but also how are they taken care of once they get there, and what are the stresses and strains that an African-American woman deals with every day as a result of being part of a system where she is oftentimes not treated in an equal manner, and what does that do to one's health? There's this concept people talk about weathering, and there's good data these days that show that the actual impact of racism has a physiologic impact itself and the stress that comes from that. So, I think it's an important point, but, clearly better access to health. Secretary Burwell worked hard on the Affordable Care Act, made great progress. Unfortunately, we're seeing some of that progress rolled back, but we've got to make sure that we have equitable access to payment and ability to access health. Then we need to have health services that are culturally competent, not biased, and available. Here in Chicago, on the south side of Chicago, there is no longer a hospital that provides maternity care, which is a part of the city that is primarily African-American. It should not exist in America that there is a large segment of an urban city that doesn't have maternity care. These are the kinds of things we have to start looking at. Why is care unequal? And then what are the other things that add to making unequal healthcare and health status for African-American women?
Thank you, Helene. The lack of a maternal care facility in the south side of Chicago just blows my mind. Thank you to all of our panelists for being with us today. It's really a privilege to have you three who've been through this and know how to lead through these crises with us, so thank you. For those of you watching, please sign the petition and let's work to ensure the health needs of women and girls are part of the COVID response. And now we will hear from U.S. Senator Amy Klobuchar of Minnesota. We are grateful for her longstanding support and leadership of America's humanitarian response. She is calling on all of our advocates to keep up the fight. After Senator Klobuchar, we'll hear from actress and CARE Ambassador Danielle Savory about her CARE trip to Zambia.
I don't need to tell you that this is a challenging time. It is challenging already economically for so many of the people you're serving. It's challenging across the world with the injustices we've seen, really starting right in my state in the last few weeks. It is challenging when it comes to this pandemic. And the work you do to protect vulnerable populations has never been more important as we face a global pandemic that does not respect borders and nationwide pain and anger following the death of George Floyd. For decades, you've shown just what we can accomplish when we come together to help people. We need that spirit now more than ever, because only a truly global response will help spread the slow of this virus, no matter what you hear from the White House. And we know that empowering women and girls will also be critical in this effort, because when women are succeeding, so are their communities. And women are helping to lead us through this crisis. In the United States, one analysis found that 1 in 3 jobs held by women has been deemed essential. Women make up nearly 9 out of 10 nurses and nursing home assistants, most respiratory therapists, a majority of pharmacists, and an overwhelming majority of pharmacy aides and technicians. Put simply, women are on the front lines, and so are care advocates. Your advocacy and hard work make millions of lives less challenging. Make a difference in the U.S. and around the world. And you are what gives me hope that we can not only meet the challenges, but defeat them. Thank you for allowing me to join you today.
I got involved with CARE a year and a half ago. I went to Washington to lobby for foreign aid and Ivawa. I knew that this was something that was up my alley, and the fact that it was really focused on empowering women and girls. And then to know that they've been around for 75 years and work currently in more than 90 countries really meant that they had the reach. Our focus has been about early childhood education and SOAR, which is a program through CARE. SOAR stands for Strengthening Opportunity for Adolescent Resilience. And these kids are learning it and applying it. We get to go to the classrooms and watch them count and read and write, and it's working, and to see it's working is absolutely beautiful. To get to meet all the kids and young adults and parents and see their lives and the beauty of it and the hardships and how CARE is helping and how they themselves are lifting themselves up as a community, and it's been a life-changing experience.
Good evening. My name is Michael Gerson. I'm a columnist for the Washington Post, a senior advisor at One, and an alum of an extraordinary CARE learning trip to Congo focused on women's justice and empowerment that really changed my life. I'm joined by 2 dedicated, passionate experts whom I can't wait to hear. Mark Green serves as the executive director of the McCain Institute for International Leadership. For the last 3 years, you know him as the head of USAID, who was really took the lead in promoting sustainable development, long-term food security, and delivering humanitarian assistance in very challenging times. Maureen Maruca is Director of Food and Water Systems at CARE. She has extensive experience in gender issues and empowering women in agriculture. Maureen joins us from Nairobi. Before we get into it, let me start with just a few statistics that frame our challenge. With the onset of COVID-19, the World Food Program predicts that the number of people facing acute hunger worldwide could nearly double, leaving some 265 million people facing famine conditions by the end of the year. Severe malnutrition would rise dramatically, and that would mean sharp increases in wasting and stunting for children under 5. Together, these factors are projected to cause a 45% increase in under 5 deaths per month in the coming year. Our global health crisis is fast becoming a global food crisis, which is putting the world's most vulnerable at risk. Mark, let me start with you. How should the US integrate efforts to combat hunger and malnutrition in its global response to COVID-19?
Mike, good to be with you, and to everyone who's tuned in, my great thanks to CARE. I had the chance as administrator and before to see CARE in action, and it really is an extraordinary organization and never more important than it is right now. So, Mike, what you referred to is precisely right. The World Food Program often refers to the risk of a hunger pandemic to follow the health pandemic of COVID. And I think that's true. We need to make sure that we're providing health food and nutrition at several different points in this process. So number one, there's obviously emergency food relief for those who are hungry, those who are starving. That we need to do. But secondly, and in some ways more important for the moment, it's making sure that we have adequate nutrition so that people are less vulnerable to the effects of COVID and the broad range of health vulnerabilities that emerge in situations like this. So the best way for families to withstand COVID and the spread of the pandemic is to have better nutrition. And then finally, we need to make sure that we integrate food assistance and food security into our programming for purposes of community resilience. In one of the previous panels, there was reference made to it, but understand that one of the ways that we stop the spread of an epidemic and a pandemic is through behavioral change communication. So we reach out to people and help them to understand those things that they can do to avoid being confronted by COVID. Well, it's difficult to have people listening to their leaders. It's difficult for people to come forward and have a sense of community if they're hungry, if they're worried about where the next meal is coming from, if they're uncertain as to their future. So the fact that we take on hunger and nutrition can't be separated from our COVID response. If we fail on nutrition, if we fail on food assistance, there's no way we're going to succeed in beating back the COVID pandemic.
Mark, that makes sense. Maureen, we know that women often eat least and last, especially when food is scarce. What role do you see for women and girls in responding to this complex challenge?
Thank you. Actually, that's true. Growing up as children, we never imagined that our mothers went hungry because they ate last or ate the leftover foods that we had or never ate at all, or the chunkier pieces of meat were served to our fathers and men in the household. And so women continue to be left behind in crises such as this as we have. And one of the things that we really need to do is to recognize women as leaders and put them on the leadership tables and in places where they make decisions. We need to recognize that women are viable farmers, they grow food. We need to recognize that women are market players, they are agribusiness, they are agribusiness women, and that they trade in food and that they play a critical system in food systems. But the other thing that we also really need to do is to have the data and the evidence that informs policy on the role of women, because a lot of responses in crises such as this has largely been gender blind in the data that we have collected. Lastly, we do need to work with men and boys in the empowerment of women. And in so doing, we need to ask women what they need and not make assumptions for them.
Good. Mark, we have seen that some of the most dramatic effects of the pandemic are not necessarily the disease itself, but the social mobility restrictions that come with it. Farmers can't get to their fields, food can't get to market. How, in light of all this, are we going to prevent the World Food Programme's nightmare scenario?
Well, so one of the things that you're pointing to is something that's oftentimes hard for people to think of, and that's what happens when we come out the other side of the public health challenge that is COVID-19. Because right now what's at risk is, in so many places, communities are at risk of losing an entire planting and growing season. And so even when they get beyond the immediate health challenge, that what lies ahead for them? They've lost an entire season that they rely upon for survival. Secondly, in so many parts of the developing world, particularly in Africa, and I say hi to my friend from Nairobi, where I once lived, but in so many parts of the world, food security is the economic backbone. An economy cannot grow, it cannot rise if we aren't dealing with everyday issues of being able to harvest, of being able to put value onto those crops. So that's terrifically important. But the other piece to it is there's been such great progress made in women's empowerment and breaking communities, in particular women, from dependence upon government, dependence upon donors, giving them greater choices in their economic future. Unfortunately, if we're not careful, all of that is at risk. And so as we take on questions of economic opportunity, we need to be looking for ways to make sure that technology is in the hands of women, in particular farmers, that we're making sure that we get to them drought-resistant seed and the materials that they need to begin thinking ahead. And of course, all of this is dependent upon good education. You cannot separate from these challenges access to information that particularly young people can use to build their own future. So I guess the takeaway is that I wish we could separate these things out, but we can't. And so even as we face this global pandemic, which challenges us in so many ways, we have to be thinking ahead about ways that we empower women, about ways that we recover that lost season, about ways of giving women those choices that they need to continue to build upon that progress that we're all so proud of.
Thank you both. I really wish we had more time. It's a fascinating discussion. A lot of people around the world are now depending on the US reaction to this global crisis. A serious response, as both have argued, is going to require focus on the pandemic and the emerging hunger crisis. That's going to require Congress to pass at least $12 billion in funding, probably more. And that will only happen if this community mobilizes for urgent, major push on this issue. So it's a decisive moment, and I thank you all for your essential voice.
Thank you.
When you hear the word COVID-19, what do you think of? Coughing? Toilet paper? Social distancing? School closures? Hygiene supplies? Hospitals? Masks? But you may not think of the billions of people in poor communities who don't have access to many of these things. For the 70 million refugees around the world, time is of the essence. In crowded refugee camps, social distancing is virtually impossible. People who don't have a home can't stay at home. That's why CARE, a leading humanitarian organization, is positioning hygiene supplies, hand washing stations, and clean water to the places in greatest need. You can join CARE by sending a care package to those who need it most. Your donation can send a care package to people in need. What you do today can make all the difference tomorrow.
I did it too soon. I apologize. Hello, everyone, and I'm so honored to be here with you. My name is Bellamy Young. I'm an actor and a very proud CARE ambassador. Thank you to all the speakers who have gone before us, the wisdom and the mindfulness, and I'm so excited to see what's to come. I've been boots on the ground with CARE in Rwanda and in DC last year for this summit. We learned how to make effective legislation, and then we lobbied on the Hill, which was one of the most incredible days of my life to date. Just to really remind us all, and I know that you beautiful, at least 800 people that are gathered here with us, you know that we are the people. Democracy is us, and we bring the change that is to come. So on that note, I would like to introduce you to the incredible humans that I have the honor of being in conversation with today. The first is Valerie Jarrett, whom you know served as a senior advisor to President Obama. During her time in the White House, she championed the creation of equality and opportunity for all Americans and helped cause economic and political empowerment for women in the US and all around the world. We are also honored to be speaking with Sofia Spreckman-Siniero, the newly appointed Secretary General of CARE International. Though Sofia has been with CARE for over 25 years and has been integral in placing women and gender equity at the center of our work. Today, she is leading the organization toward another important moment in CARE's history, the development of CARE's 2030 vision. But before we get into questions with our esteemed conversationalists, I wanted to take a moment to add to the context that everyone else has provided, because we all know the moment that we are in. It is a very unique moment when fundamental aspects of structural inequity have been laid bare for us all to see. And these inequities impact everything from whether you can get an education, whether you can earn a living, whether you will have enough to eat, whether you are able to protect yourself from COVID or your family from COVID, or even whether you're able to move freely and safely in your own community. We are reminded yet again that justice is not equal. If we are to meet this moment, it is critical that women, particularly women from minority communities, are included and involved up front from moment one. Women's leadership is fundamental to building lasting solutions that promote equity and address underlying causes of the challenges we confront today and those we will confront tomorrow. So with that, I am thrilled to be joined by these two accomplished women for today's discussion. Valerie, I will. Hi. I am so glad to see your face.
That's how I feel about you and everybody who's joined us today. What a inspiring, replenishing conversation this is.
Amen to that. I will start with a question to you, my love. In the US, racial injustice remains pervasive across our country, from police brutality to economic and health disparities. Why do you think it's important to ensure that women, and particularly women of color, are at the table and have leadership roles as we address systemic issues?
Well, the people who have the most at stake, the most to lose, should be a part of the solution. And I think for far too long, women and women of color haven't had a seat at the table. As Shirley Chisholm used to say, if there isn't a seat, bring a folding chair. And we've been trying to muscle our way in. In the United States, women are half the population. And women also, 40% of women, working moms, are either the sole or primary breadwinner in a family. And so the decisions that are made around health to close the health disparities, around economics to close the wealth disparity, around important benefits from paid leave to paid sick days, to affordable childcare, to a workplace free from sexual harassment or violence. All of these issues affect women. And so why wouldn't you have the people with the most to lose at the table? And I would give you a visual that I will be seared in my mind for a very long time. When a couple of years ago, the Republicans in the Senate were trying to decide about whether or not to repeal the Affordable Care Act, a very important law here in the United States that has provided health care to 20 million Americans, many who've not had health care before, health insurance before, made sure that no one is discriminated against for a pre-existing condition, give women access to preventive care without a copay. When they were debating the issue, they formed a committee of 19 white men. They couldn't find any women in the Senate to participate when one of the issues is taking away preventive care that would have had a direct impact, particularly on women of color. Access to birth control, choosing when we have our family is one of the single most important issues that affects the trajectory of a woman's life. So there's a very good case to be made that given that women are half the population, we're graduating from college at higher rates than men, why wouldn't we have a seat at the table?
Amen to that. Thank you. Sophia, I would love it if you would speak to us all about why achieving social justice is a core part of CARE's mission.
Of course, at CARE for many years, we talked about addressing poverty and social injustice, but we really have evolved our thinking. We now say poverty is injustice because there's simply nothing fair about poverty. In this world, the group you're born into, your sex and race, ethnicity, sexuality, nationality, disability, defines how likely you are to go to school, experience violence, eat good food or eat at all, being healthy, survive a crisis, and whether you're likely to become a leader. So the simple, very, very random fact of where you are born has a huge and profound consequence for your life. So it is as simple and as complex, Bellamy, as this. We cannot end poverty without addressing social injustice. These fights belong together. They cannot be separated. So social injustice matters hugely to our work at CARE, since poverty is an injustice in itself. Poverty is injustice, and I might be stating the obvious, but poverty is injustice.
There's a lot of obvious things that we need to say out loud these days. So speak, 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 Sophia. Beautifully said. I'd like to ask both of you to give your thoughts to everyone on the following. We often talk about the importance of women being at the table to ensure that decisions and policies reflect women's needs. Do you see a correlation between more gender balanced leadership and more gender equitable responses? Sophia, let's start with you.
Well, I certainly do. There have been good examples of positive leadership from women during the COVID-19 crisis, such as from New Zealand or Germany and many other countries, in fact. We also have evidence of this from CARE's work, where we have promoted and encouraged women's leadership in response to emergencies. It has actually made all the difference to achieve better results. When women lead in emergency responses, we have seen increased cooperation within the community. We have seen communities recovering faster from the impact of a disaster. And we have also seen that women taking the opportunity of their engagement in responding to a disaster, taking that opportunity to rethink traditional gender norms and roles, both in their communities, but also in their homes. So with all of this positive evidence, it is just not acceptable that women are underrepresented in teams responding to COVID. Today, CARE released a report that is entitled, "Where Are the Women?" The report shows that women only make up about 1/4 of national teams responding to COVID. And by excluding women from decision-making teams and platforms, we are making slower progress in overcoming this crisis, in achieving social justice and equality, and in overcoming poverty. So absolutely, without women at the table, we will not make a dent on this crisis or on any crisis.
Valerie, please give us your thoughts too.
Well, no surprise, I completely agree with that. Look, I start from the proposition that diversity is a strength. It is a competitive advantage. And there is fortunately a mounting body of evidence that shows that the decision-making process is healthier, more robust, more informed if the people whose lives are going to be impacted by it are at the table. And that there is a different chemistry when women are present. They're going to look at life from a different perspective than men, just quite naturally because of who they are and what they are. And so to inform the decision-making process, We need to make sure that there are voices that look like all of us at the table. This isn't to the exclusion of men. Men are a part of the diversity too. But I do think that we process information differently, we lead differently, we're much more collaborative. And as we're facing this huge, huge pandemic, collaboration and cooperation and sharing of information is so absolutely essential. And here in the United States, as we're facing the challenges of the vestiges of slavery and Jim Crow and systemic racism that occurs across our country, the police department just simply being a microcosm of society, we need reasonable voices to come to the table who are empathetic and who emphasize cooperation and listening to one another and actually not talking at each other, but speaking with one another. And let's face it, we're just better at that.
Amen. I know we're running very short on time, but I want to be able to ask each of you this last question for your brief thoughts. Women are on the front line of the COVID response, whether they choose to be or not. They disproportionately are in caregiving roles, often unpaid, and in work that we are quickly recognizing as essential. They are also proactively stepping in. They find ways to get food. They help their community. They help their family. How do you see COVID impacting long-standing gender norms and underlying inequities? Valerie, let's start with you. And again, we have to be brief, although there's great knowledge to impart.
Look, COVID-19 has laid bare, as you said, Bellamy, in the introduction, some very basic disparities that have existed for a very long time. And as we emerge from this, I think it is important that we not slip backwards to where we were. And that will be hard to do because we've just been faced with the reality. I'll just zero in on one issue, paid sick days. We've been talking about that for just decades. The United States is one of the few countries that doesn't have a national paid sick policy or a national paid leave policy. Well, COVID has showed the impact that this has on the bottom line of companies where people are showing up to work sick and then spreading illnesses amongst them, as well as just the livelihood that has been put at risk because people can't afford to even take a day off from work. And so I think in a sense, we have an opportunity here now that we've put a spotlight on what we on this call have known has been a challenge for a long time, to say, as we rebuild moving forward, let's make sure that we put the safety nets in place so that women can succeed going forward when we are in these high risk, high impact, extremely valuable professions.
Sophia?
Well, of course, agreeing with Valerie, a lot of agreement here. But negatively, we know that the pandemic has, of course, led to increased rates of gender-based violence, which are already, if I may say, at pandemic levels, with 1 in 3 women experiencing violence in their lifetime. And as you mentioned, Bellamy, and due to gender norms, the burden of unpaid domestic work at home has increased for women around the globe in the context of the pandemic. Another example and consequence, women, especially in developing countries in the global south, are more likely to work in the informal sector, for example, as street vendors, where they have little or even no government protection. And of course, the majority of frontline workers in healthcare and other caring sectors are women. However, maybe let me end on a positive note. When all is disrupted in a crisis, space is also created for challenging existing gender norms. I have seen this frequently in my 25 years with CARE. Let me give you a very concrete example. Recently, I visited a country in crisis in Western Africa, in which the use of contraceptives is taboo. Yet I saw women lining up in front of a clinic supported by CARE to obtain contraceptives. Given the crisis, their husbands, the community, realized that it was better to plan for the birth of their next child. And we know from CARE's experience that once women start using contraception, there is no turning back. So in this case, the crisis led to significant change for women, a change which probably would not have so easily happened without such a crisis. A crisis is like a crack in the system, a crack into which to filter positive, transformative change in favor of equality, of social justice, and in favor of defeating poverty.
Sophia, thank you. What a beautiful note to end on. And Valerie, thank you too. I'm so honored to talk to you both today. And everyone who's with us on the device that you're not watching the webinar on, go and sign the petition, care.org/fightcovid. And I will pass it on. You have a special treat coming up, everyone. Have a beautiful day.
The most important act of advocacy is educating leaders about what's possible and what's expected. But the second part is to tell them what to do. Do not presume that once somebody knows there's a problem that they automatically understand the solution. And more importantly, in the middle, that they understand why action is necessary. I believe that the three things you say are, here's the problem, here's why it's a problem, and here's how you solve it. And that's how advocacy is most effective. Tell people what they need to know, tell them why they need to know it, but always explain to them what to do. And then most importantly, hold them accountable. Voting matters. Voting matters because it's how we hire the people who should take the right actions.
So first of all, thank you for an extraordinary conversation with Valerie and Bellamy and Sophia. You perfectly embodied women's leadership and its power. So that was just a sneak preview, the Stacey Abrams conversation, which was recorded previously. She couldn't join us live because she's supporting full voter participation in Georgia's election today. But you'll have the opportunity to watch our full conversation about what we can all do to ensure that women and girls aren't left behind as we recover from COVID-19. The video will air after my conversation with Secretary Clinton, or you can watch it later. But we're so thankful to Stacey. She is an incredible leader and a wonderful friend, working to make all of our communities equal, truly. So again, don't forget to act. Sign the petition asking Congress for no less than $12 billion for a global COVID response. So let's check on how we're doing here. It looks like we're getting very close, 14,000 plus. So please keep signing, please keep spreading the word. It is my enormous pleasure to welcome now former Secretary of State Hillary Clinton. I could spend our entire remaining time together sharing Secretary Clinton's extraordinary biography, but I believe that her history is well known to all of us. So I will simply say that her life's work focused on defeating poverty, fighting for social justice, and lifting up women and girls here and around the world is perfectly aligned with CARE's purpose and mission. Her journey has been truly historic, and we are so grateful to learn from her today as we promote women equal to combat injustice and to overcome this pandemic. So thank you so much, Secretary Clinton, for being with us.
Thank you so much, Michelle. And I've been listening to the conversations. What a rich and important discussion you're having today. So thanks for letting me join you.
Well, you are the capstone, and so we could not be more excited and grateful to have you with us. A lot of people are comparing this very difficult moment to 1968. And I know that so many of us have seen and really loved the documentary about your life on Hulu. I know that you felt strongly about young people raising their voices and shaping the direction of the country at a time of deep division. So I just would like to hear, how do you look back on that time? What are the comparisons that you see to what we're living through now? And for instance, with the critical work of the Black Lives Matter movement?
Well, Michelle, I think there are certainly some similarities, but there are probably more differences. On the similar side, it was a time of great tumult in our country with the assassinations of Dr. King and Senator Robert Kennedy. There was a lot of distress and terrible anger and sadness because of that, which led to uprisings in a lot of our cities. It led to the election of a law and order president who sadly did not follow the rule of law and was impeached and resigned from office. So there are certain similarities, but I think the moment we are going through now is extraordinary in the best sense of that word. The outpouring across America, led by young people, a multiracial, multi-ethnic collective of people coming out to protest, saying we are not going to put up with this anymore, there must be changes, is much bigger, more long-lasting, and is provoking a more positive response from elected leaders, from police chiefs to mayors and governors, obviously members of legislatures and Congress, to look to see what can be changed in the law and in regulation that will protect Black lives, because Black lives matter. And I'm hoping that the energy and the very positive impulse of the peaceful protesters will help to bring about significant change. Now, we still have a lot of work to do, and it's work that you've done for years, bringing people together, trying to find common ground, looking for solutions to problems, trying to move a positive forward agenda. But I'm hopeful that this is not just a quick and unfortunate interruption in life as usual. I'm hoping that this is a lasting mobilization of young people, so that they will not only protest in the streets, but they will vote. And I know you're going to have our mutual friend, Stacey Abrams, on to end this great program. And that's been her message. Well, it was Barack Obama's message, don't boo, vote. And I would say protest and vote. Protest alone is not enough. So please use that energy to register voters, stand up and fight for fair and free elections, and let's truly change the direction of our country together.
Well, it's an election day here in Georgia, and so I hope that that message is getting through. And I do also feel hopeful that the seeds that are being planted now truly are transformational and different in a significant way. So I really appreciate that reflection and seeing the difference around where we were and where we are today. So let's talk about the international context. As Secretary of State and as First Lady, you spend a lot of time in global hotspots. We do that same thing at CARE. We're constantly reminding our stakeholders that no community is safe until all communities are safe. And we certainly see this interdependence more powerfully than ever with COVID-19. It knows no boundaries, and it's magnifying the inequalities and the racial injustice. Again, we see this here, we see this everywhere. I know as Senator and following 9/11, as Secretary of State, you've dealt repeatedly with supporting communities in crisis. So I wonder what leadership lessons you can impart about the steps that we all need to take to build back better, more equitably, and especially, how do we support women to lead, especially women who are identify as Black or brown, to create this new ideal and equitable future that we want?
Well, I think that's one of the key questions that we're going to have to come together and answer, because here at home, we clearly have an enormous amount of work to do. Our health system was overwhelmed. Our public health institutions did not meet the moment the way that we would have hoped. Our leadership has been erratic, inconsistent, incoherent. So we have a lot of work to do at home. But as you rightly point out, the United States must lead on the international front as well. And I fully support your campaign to try to convince the Congress to appropriate money that can be used for a global response. One of the inexplicable decisions that the current administration tried to take is pulling us out of the World Health Organization. Now, they can't really do that. There's a lot more that has to be done, and the Congress has a say in it, of course. But just the idea that the United States, which has truly led in global health on, for example, the response to HIV/AIDS under former President George W. Bush, to think that we would be retreating from that leadership and from the only international organization that is tasked with trying to keep us healthy and to respond to epidemics when we know that in many parts of the world, COVID-19 is just arriving. It is just beginning its ravaging of populations. And there is no way that we can have a global response that helps people across the world, but also, let's be honest, helps us here at home without the United States providing leadership and financial resources. And I heard in one of the earlier discussions that there is a correlation between countries with women leaders and very positive responses to COVID-19, from New Zealand to Taiwan to Germany to Finland. Women have been demonstrating the kind of inclusive, empathetic, science-based leadership that we should be trying to promote across the world. So whether it's helping equip women through work that CARE does at the local level to protect themselves, their families, and their communities from COVID, helping frontline health workers to get the personal protective equipment they need to be able to care for patients, all the way up to leadership at the national and international level. Women have to be at the table, and women's voices and experiences have to be heard and respected if we're going to be able to deal not just with the pandemic today, but with the future of the pandemic, because unfortunately it's going to be around for quite some time.
Well, speaking of women's leadership, it's hard to believe that it's been almost 25 years since you first very clearly declared at the UN conference in Beijing that women's rights are human rights and human rights are women's rights. I wonder how you would reflect upon our progress, where we might have regressed, and where we can go from here.
Well, it is. It'll be 25 years in September, and I've thought a lot about how far we have come. We've made progress, particularly in education and healthcare. We were making pretty steady progress in maternal mortality, but unfortunately, we've seen some setbacks, including in our own country, where you are 50% more likely in America to die in childbirth than your mother was. And again, it's a burden that disproportionately falls on African-American and poor women. So we have had progress. We've changed laws and regulations. We've permitted women to inherit property who 25 years ago could not. We've permitted women to move into the workforce by changing laws that prevented them from doing so. But at the same time, we've not seen the progress in the full participation in the economy and in our political system and in the security sector that we had hoped for. So we're at as I like to say, either a pivot or an inflection point. Are we going to continue to push forward the agenda for gender equality, or are we going to stall or even fall back? And sadly, there is a correlation between the rise of populist nationalist movements and leaders and the backlash against women's rights. And I think we have a lot of work to do. And I know CARE is intensely focused on how we continue to push the gender equity agenda. And I think we have to recognize that as much progress as we've made, even in advanced economies and democracies, there's always a danger of being pushed back that we have to stand against while we help our friends and allies across the world to make more progress as well.
Yeah, I think it is important to recognize that it is a continued fight and a continued push, both here at home and around the world. And we have a long way to go to reach the Sustainable Development Goal 5 for true gender equality.
That's right.
So you spoke extraordinarily eloquently about the importance of America's humanitarian leadership, and you know exactly what that means and the ripple effects that that has around world leaders and how America can make a difference at perhaps the most critical challenge that we have faced in any of our lifetimes. America is not leading in the way that it has in the past. And so you are talking to hundreds of advocates here. I wonder how you can help equip all of us to do a better job of convincing Americans of the importance of foreign assistance at this particular moment.
Well, we had really made a lot of progress, Michelle. I was, very supportive of a lot of the humanitarian aid, particularly the PEPFAR, the effort to provide support for HIV/AIDS around the world, particularly in Africa. When I was in the Senate under the Bush administration, obviously when I was Secretary of State in the Obama administration, we worked very hard to expand and deepen and really understand better how we could provide more opportunity for people to make a living, to get access to healthcare, to get into schools and stay there, especially for girls. And we added a real emphasis on women's rights because we know that where women are able to exercise autonomy, to make decisions, countries are more stable and they're less warlike, they are less insecure, they are more just. So I was proud to see the first ever global women's ambassador named in the Obama administration. I was proud to see USAID really work to include gender markers and signals of progress in a lot of the aid that we were distributing. And sadly, much of that has stopped. Much of it has been relegated to the sidelines. There doesn't seem to be a continuing commitment to women's rights, opportunities, and participation. And a lot of the programs that are really important for tracking down disease before it affects us, for trying to work with countries so that they treat their women better, and by doing so, they stabilize families and communities. A lot of that has been diminished or even eliminated. So hopefully we'll have the opportunity to revisit that next year with new leadership. But I think the people who are on here right now and are supportive of CARE's work and mission should be reaching out to members of Congress. In our fast-paced world with instantaneous communication, I think people overlook that personal contact, outreach to the offices of members of Congress and senators, talking about the importance of America retaining our leadership in global progress and institutions that matter, making the case that what happens over there, as we've seen with this pandemic, can come to rest right here at home. So I would urge all of the participants today to keep reaching out and make the case. And don't give up, because you never know what might connect. I saw that with members of Congress when I was in the Senate as First Lady, and certainly when I was Secretary of State.
Yeah, I think that don't give up, and you never know what that pivotal turning point conversation will be. Right. We have, speaking of advocates, we have one of our wonderful advocates, Angela Harvey, who's also a member of our CARE Action Board of Directors, to ask a question.
Great.
Hi, Secretary Clinton. I'm so excited to speak with you. My question is, as we strive to a more equitable world, can you share some lessons about how you stay hopeful and how we as advocates and citizens can identify new paths and approaches that lead toward justice?
Oh, Angela, it's such an important question right now. Thank you. Thank you for being an activist. I think that over the course of my activism, my public service, I've always tried to keep focused on the goal and the people we're trying to help and the systems we're trying to change, because it can be discouraging. You feel like it should be self-evident that there needs to be change, there needs to be more justice, there needs to be more fairness and equity. And yet you run into opposition and obstacles where people don't agree, or where people are trying to hold on to an outdated and unfair system. So number one, get up every day and believe you can make a difference. Maybe it's just, convincing one person. Maybe it is just coming up with a new idea. Maybe it's protesting with a lot of other like-minded people, but really believe you could make a difference. And also find support amongst your fellow activists. Have people who support you, who understand you. They may not, feel comfortable doing what you do, but they're going to be there when you need them, because you can't be on a 24/7, every day a year campaign where you're burning the candle at both ends. You've got to have some time for your own life to unfold and the people who are with you to support you in doing that. I think it's also critical to make the case, even in the face of opposition, for people to register and vote. That's one of the reasons why I am supporting and helping provide funding for Stacey Abrams, because she took a disappointment that was so wrong and turned it into a purposeful mission, to try to make sure that what happened to her didn't happen again. And she goes into it with her eyes wide open. She knows it's hard, because literally she knows that the other side is going to do everything they can to prevent people from voting, but she's not going to give in to despair and discouragement. And so I think that there are ways to create space for yourself, to encourage others, but also to feel encouraged that, one small step can lead to a great big forward movement. And we all have to be part of that now. I'm very hopeful, Angela. I really, really am. I feel like what's going on in the country now has opened eyes that were never opened before. People who had never demonstrated before are taking their children. I have friends sending me pictures of them with their families in Washington and New York and LA, because they want to make it clear they're not going to be on the sidelines any longer. They know that what's happening will affect their lives, their children's and grandchildren's lives. So don't ever give up. Keep going. Harriet Tubman, remember, you're heading toward freedom, and you're going to get there if you don't give up. You hear the dogs, you hear the guns, you don't turn back, you keep going. And I think about, my foremothers a lot, because so many of them fought for causes that they never saw come to reality in their own lives, but they never, ever gave up. So I know you won't, but your voice and your support for others who care about care and care about what kind of country and world we have will remain critical in these months and years ahead.
Secretary Clinton, I can't think of a better way for us to close this summit than never give up and keep on taking those giant steps forward, and also invoking the gutsy women. You and Chelsea wrote a beautiful book about gutsy women, and reminding us all of the changes that we stand upon, and then invoking the possibility for all of us to be those gutsy women that will change the world. And I would also just say to you that I can't think of a more gutsy woman in our history, and we are incredibly grateful to you for continuing to encourage us and inspire us.
Thank you so much, Michelle, and please, everybody, keep going with CARE's mission. It's more important now than ever. Thank you.
Thank you, Secretary Clinton. And we've had over 5,000 people join us from around the world, and they've come from 50 different states and 75 different countries. So thanks for lending them the encouragement that we need. And I also want to thank all of the summit speakers. We've had a fabulous lineup. You've taught us about how we can keep going, how we can activate and advocate for change and tackle the challenges of both the global pandemic and the systemic racism and the inequality around us, but in a very hopeful way. So finally, it looks like we've met our goal. We set out a goal for 15,000 emails and letters to Congress. We have reached that and actually overachieved. So 16,712, but please share the petition on social media channels and let's see if we can do even more as we go forward. CARE remains dedicated to helping you find new ways to advocate during these uncertain times and really critical times. The CARE Action Team is preparing a series of engagements for you, launching today, continuing over the whole summer and concluding with a virtual Hill Day in August. So we hope that this series will deepen your engagement and your knowledge and your action in support of CARE's call for a global COVID response. It is urgent and lives are at stake. You can view the videos and remarks in the app. And finally, again, thank you for joining us. These are incredibly challenging times, but if we use our voices, take action together and demonstrate the power of caring, we will make this a more just and equal world for everyone. We have a unique moment, and as Secretary Clinton said, we must seize it now. So please stay to hear more from my pre-recorded interview with Stacey Abrams, and thank you all again for participating. Good night.
The most important act of advocacy is
Stacey, welcome. We're so thrilled and grateful to have you as a part of CARE's conference this year. It's a really great thrill. And you know, after I think it's 20 plus years of friendship, we've had a lot of different conversations, and whether that's been about poverty or social justice or gender equality or how we get more women leaders. We now have an opportunity to actually have one of those conversations, but to share it with the broader CARE community. So I'm really grateful for that. And I want to make sure that that I give you just a short introduction, even though you really need no introduction to this group. You have a huge number of fans. Stacey has an extraordinary biography that includes private, public, and civic sector leadership, 11 years serving in the Georgia House, and 7 as the Democratic leader there, a historic leadership. In 2018, everybody knows about Stacey's really amazing leadership of a campaign as the Democratic nominee for governor in Georgia, a historic campaign and one that has now lifted her up into the national spotlight. And finally, I would say that Stacey is shaping our public discourse and shaping the future of our democracy. And she's doing it through 3 different organizations: Fair Fight, Fair Count, and the Southern Economic Advancement Project. And so, Stacey, you truly are leading the way, and we can't begin to thank you for joining us.
It is my honor, Michelle. The work that you and CARE are doing, not only around the world, but the work you're doing even locally and domestically matters so much, especially in this moment. So it's an honor to be able to join you.
Well, so tell us from your perspective, you know, COVID is so much on our minds, and obviously it's had a devastating impact both here and abroad. And you've been someone who's really fought for social justice. Can you talk about how it's revealed the inequities, the injustice here at home and internationally that I think that you've been pointing to for a long time?
We know that systemic inequality exists. We know it's built on a foundation that started our nation. And while what is beautiful about America is our continued attempt to right past wrongs, we cannot fix those things we do not acknowledge continue to persist. And what COVID-19 has revealed both domestically and internationally is that those who are the most vulnerable are also the least resilient, and that the infrastructures we built in both the United States and around the world to address these inequities have been insufficient to the task. The policies that permit communities like those in Georgia and across the South to have the highest poverty rates, but also have the lowest coverage rates for healthcare. Those who have the least flexible jobs are also the ones who do not have access to paid medical leave and may likely be the ones who lose those jobs the fastest and are the slowest to recover. And when you take that, when you broaden that to an international conversation, we're talking about nation states that are grappling with development, that are trying to enter a world economy and find themselves shoved back, not only back into poverty, but into a devastating set of challenges where they're already grappling with existing disease, and you're adding a pandemic atop that without the humanitarian supports that in so many years past have helped them survive and to recover. And so both in the United States and around the world, we're watching the most vulnerable, typically and almost predominantly women and children, grapple with challenges that they are structurally not only unable to meet, they are actually prevented from meeting because of the policies and the imprimatur of government and of ideology that doesn't allow their active engagement in solving their own problems.
Well, you well articulated it. And if you think about, for instance, the UN, we only met a half of the threshold of what was required last year for humanitarian needs. And then you add on the suffering of COVID, and you think about also the downstream impacts around hunger and extreme poverty and what that is going to mean. So it is a devastating situation already for suffering communities and vulnerable communities and low-income countries. And yet there's so much suffering here at home. I wonder how you can help us make the case for international investment, and how do we equip our advocates to make that case?
I think there's both the practical and the philosophical. On the philosophical level, we are part of a global community. And the reality is what America does speaks to who we are in the world stage, but it also speaks to our ability to leverage and to push action among other international actors. And to the extent we flail, or worse, we walk away from our obligations, we are giving the signal that it is okay for us to abandon the responsibility we have as a part of a global community to serve others. And that fundamentally is counter to who we have built ourselves to be as Americans, and what we believe as a national ethos, that we do not let suffering happen if we can prevent it, if we can intercede. On a practical level, disease does not recognize borders. And so the challenge that we have with inaction on our part, the United States pulling back from a global responsibility, is that we are endangering our own people. We know that one of the reasons Ebola did not come to the United States was that we were aggressive in putting together a global health security system that said we are going to serve the most impoverished populations that face this challenge, because if we can stop it in its tracks, it will not infect our people. And we did so successfully. We have watched presidents in other nations invite the US in to be of support because they understood that their economic health was directly linked to their physical health, and that the United States understood that if we could stop that from happening, we could not only save the lives of our people, we could actually save the global economy. The challenge we face today is that if we do not invest the $12 billion necessary to provide entrance to a solution for global restoration and global recovery, and certainly the basic humanitarian needs that people face, then we are not only abandoning our philosophical premise as a nation, but we're also abandoning the practical reality that a global health security system means we have to provide support. We watched in small measure what just happened to Taiwan, one of the few nations that has successfully battled back COVID-19. And because of the United States' abandonment of its position within the World Health Organization, we watched Taiwan being denied observer status. But we also watched with the World Health Assembly their denial as an attendee. Those moments of American intervention, but more importantly of American status, when we stand up and say that we believe that more should be done when we invest, that changes the outcome for the world. And so we put ourselves at both practical and philosophical danger if we do not do what we should.
Stacey, that was a perfect summation, I think, of both the moral and the strategic. And if you think about it, also the economic and the national security imperative for us to I think act and invest, and also just the basic realization, which I think so many Americans understand. In fact, there was a poll that just said that 80% of Americans did believe that we should invest internationally because they know that that no community is safe until all communities are safe. So it's really important for us to be able to continue to articulate that.
I want to tell your advocates three things. One is that our first responsibility is to assume nobody knows what we care about. There is a tendency to think that because it occupies our minds and our hearts, that other people share the same either energy or that they don't care. And often it's that they don't know. And so the most important act of advocacy is educating leaders about what's possible and what's expected. Don't presume they know and just have thrown it aside. Presume they haven't heard it from you and speak up and tell them what you need. But the second part is to tell them what to do. Do not presume that once somebody knows there's a problem that they automatically understand the solution. And more importantly, in the middle, that they understand why action is necessary. I believe that the three things you say are, here's the problem, here's why it's a problem, and here's how you solve it. And that's how advocacy is most effective. Educate people about what the challenge is, explain why it matters. Just as we discussed, the issue of not operating globally is that those global challenges will meet us here at home if we do not take action. And the solution, $12 billion. That sounds like a lot until you realize just how much the economic impact to the United States of a global economic collapse will be. And trying to recover from a collapse is much harder than preventing one by engaging in the basic humanitarian behavior that we know we should do. And so tell people what they need to know, tell them why they need to know it, but always explain to them what to do. And then most importantly, hold them accountable. Voting matters. Voting matters because it's how we hire the people who should take the right actions. It's also how we fire the people who don't do what they should. And in between, if you decide that the best way to get rid of someone who isn't acting properly is to stand for office yourself, that's the best solution you can find.
I love that. A call not only to action, but to running for office, and nobody better than you to make that call. So speaking of which, let's talk about women and girls on the front lines. We know that, for instance, 70% of the caregivers around the world and here at home are women. And yet they are not always at the table, so to speak, at the table of leadership and decision making. We know here in the US, the COVID task force that was put together by the president has only 2 women out of 27 members. And so from your own personal experience and from your reflections, can you talk about how we can get more people around the table? And how can we ensure that women and girls are informing the solutions and this fight that will necessitate that we hear and listen to every voice?
I think we have to begin by recognizing that no one is going to invite us in. I've been recognized for my outspoken candor about issues. But part of that is because I grew up in a community that was often overlooked, a community that wasn't seen and wasn't heard. My parents were super voters. They voted in every election, but I can't tell you of a single politician that ever knocked on our door. My parents raised me to understand that your job is to fix problems, but you can't fix problems when you're only talking to folks who face the same challenges. You have to speak up. And that means that we have to demand attention. And sometimes it's discomforting, it's often uncomfortable, and it can feel counterproductive. But I always remember that I'm not simply speaking for myself, I'm speaking for every person who occupies a similar space, but I, at this moment, have the opportunity to stand up and say, here's what's necessary, especially for women and girls. But the second is that we have to actually fight for our seat at the table. And sometimes if we can't fight for our seat, we need to build our own tables. When I didn't become governor of Georgia, my responsibility wasn't to simply hang my head and feel sorry for myself. It was to try to solve those problems anyway. And as Michelle pointed out, as you pointed out, I created 3 organizations to tackle the challenges I saw. And I'm not saying everyone has to create national organizations, but we don't have to cater to the notion that if we aren't picked, we aren't worthy. That's not the answer. If we are not picked, sometimes we have to try again, but more often than not, we just have to find a way through the back door when we couldn't get through the front. But on a macro level, what we cannot allow are people to keep getting hired, keep getting elected, and continue to ignore us. When people ask for your vote, we need to demand that they show us how they're going to serve us. And that means that they can speak to our issues, that they know that 70% of women are the caregivers, are the supporters, that they understand that the disproportionate effect of COVID-19 is having on essential workers who typically are women, caregivers, teachers, nurses, essential workers. And we have to be willing to not only call their names, but to offer solutions for what should happen. No one is going to save us. We have to save ourselves. And if they don't invite us in the door, we not only need to kick it in ourselves, but make sure we bring a lot of friends to come in through with us.
I love that. And you are bringing a lot of friends. You're bringing millions more friends, and you're creating new tables. So thank you for embodying that strategy. So let's talk about how do we build back more equal? And every crisis presents an opportunity, and people have talked about this is a real challenge for us to think about how do we transform and how do we deal with some of the systemic inequities that have been plaguing our communities and our world. So do you see hope for that? And how would you instruct us to think about how we all play a part in that?
In the immediacy of the moment in the United States, there are two tools that are at our disposal. The first, of course, are elections. It's why it's so critical that we advocate for vote by mail, because vote by mail means that we expand the number of people who can participate in the elections. And this is so critical because the decisions about how we recover from this pandemic, but also the decisions about how we prepare for the next crisis, will be made not by the people in office today, but by those who are elected on November 3rd to lead us forward. And so voting is such a critical issue, but we can't wait for November. That means participating in the primaries that are happening in every state. And when it gets to November, it means not just voting for the top. We have to vote up and down the ballot, because the decision about whether your children go back to school in the midst of a pandemic will be made by your school board members. The issue of whether your city has the ability to stop foreclosures and stop evictions, that's going to be made by your mayors and your city council members and your county commissioners. The question about what's going to happen with budget cuts and whether we're going to lose access to the very fundamental resources families need will be made by your state legislators and by your governors. And then, yes, we have to vote for Congress. We have to vote for our senators. We have to vote for the president, but we cannot abandon any level of government, because the moment you ignore one level, that's the level that's going to do the greatest harm to the communities you care about. Voting is absolutely essential, but equally important is the census. One of the ways we tackle structural inequities is that we create a lot of programs. We have more than 300 programs in America today that are funded, and the funds are distributed through allocations from the census. The census doesn't just tell us who's here, it tells us what people need. And so the systemic inequities, overcrowded schools in the midst of a pandemic, cannot be solved unless there is investment in making sure that children have less crowded classrooms. That happens through the census. Making sure that frontline workers have PPE and that we have adequate hospital beds, that's determined by the census. The issues of how we take care of our communities, the dollars that go into almost every issue you can imagine, it's determined by the census. And so if the communities that are the most vulnerable, if they are not included in the census, the resources will never follow. And the last piece of that is that the politicians who get elected, the lines that are drawn from school board to Congress are drawn based on the census. And so this simply isn't a conversation for 2020, it's a conversation for 2021 through 2030. So that when we have COVID-25, if that's what happens, the elections, the selections that we make in 2020 are going to have an impact on everything that happens over the next decade. All of that is to say two things: vote and fill out your census. Those two things are the two most powerful tools we have in our democracy. And this is the year that we can use those tools to build the future we need, to build the recovery we deserve.
A very, very powerful reminder to lift up our voice and to take action and to be counted. So maybe one final question, which is, we often think about government's role as safeguarding us, protecting us, and often that falls from our perspective in terms of our investments in our military. But we've seen, I think, that that our health security, our community-based health infrastructure is fundamental to our safety and security. And I wonder if you could talk a little bit about what you think that might mean in terms of investments in our, again, fundamental health systems for our nation, but also internationally.
We always begin with what we can do here because that sends the signal about what's possible abroad. The United States does not have an adequate public health infrastructure today. And we see that every time we see a governor on television begging for access to PPE, when we look at the cover of the New York Times and see 100,000 names because the United States has the highest infection rate and the highest death rate. Part of that is because our public health infrastructure was not adequate to meet the moment. And so we must redouble our efforts and demand that public health infrastructure become as important in our conversations for funding as our military. It is about our defense, and we have to recognize that no longer are our only enemies other nations or terrorists. Disease will kill us. And in fact, this disease has had more of an effect on American lives than many of the wars we fought in years past. And so we have to create not only an equation, but we have to create a reality that health is a fundamental frontline defense for our nation. And if we do not defend our people against the pandemic, then we are not doing our job. And that also becomes the necessity that we see around the world. A global health security system isn't simply a nice to have. Again, disease does not care. It is not blocked by fictitious borders that were drawn on maps. No one cares where you came from, because if the disease comes with you, we're all in danger. Building a global health security system means more than simply being able to pinpoint who created the disease or where the disease came to fruition. It's about making sure that we have done what we can to block the disease where it is, to treat those who face it, and to serve those communities that are impacted by it. One of the challenges we're facing right now, and we're watching it play out in Bangladesh as cyclones start to ravage East Asia, is that one of the challenges in the midst of a pandemic is that isolation is almost impossible. When you have people crowded together because their homes have been washed away, they cannot respond appropriately to the social distancing required by COVID-19 unless there is an active and proactive thought. The same thing is true here in the United States as we head into one of the worst hurricane seasons we are likely to face. We have to stop thinking about these things in isolation and in parochial ways. We have to recognize that the United States is the most formidable nation on this planet. We have access to resources, but we also have access to ingenuity and to platforms to serve not only those who live here, but those who live abroad, because everyone is in jeopardy and everyone can be saved if we do our part. And when we lift up women and girls, when we acknowledge the challenges that they face, because they are the front lines, not only in terms of being the workers delivering services, but also as the victims facing the consequences of inaction, we should harness their power so they can speak up about what they see before it becomes a pandemic, before it becomes an epidemic that we can no longer control.
So well articulated. And I do think that this idea of investing in community and public health, which is, as we say, the front lines led by women, is so critical to our future, and certainly to our stemming the tide of this pandemic, but also to ensuring that we're building back in a way that it prevents the kind of devastation that we've seen for the next pandemic or next epidemic. And also that in that process, we can have more equitable health systems today. We can save lives that are for curable diseases like tuberculosis and malaria. And I think that's part of the building back better as we move forward, is those kinds of investments that, again, save lives and that build a more secure world for all of us. And I think that's a big part of CARE's rallying cry. When I think about CARE, I also think about 75 years ago, the creation of the CARE package, and then the Marshall Plan, which we know was, in today's terms, $150 billion plus. And so as we go forward, we do want to look back and then also look forward, I hope, with that kind of aspiration and that kind of boldness and audacity and that kind of compassion and generosity that you've also well articulated. So Stacey, any final words of inspiration and aspiration to leave us with and to leave our advocates with?
I think you just said it. The United States has never shirked from its responsibility, but we also don't shirk from opportunity. This is a moment where if we do what's right, we can do what's not only good, but we can help others do well. But it takes the voices of the advocates listening today to do the work of letting their legislators know calling on their congressional leaders, calling on their senators, calling on their local and state leaders, because we have to remember that these are challenges that may have international scope, but they begin with local action. And I know and trust that the women and men who care about care, who care about the world, can do something in 2020, because I'll tell you this, as a politician in some moments, I can tell you that the most important time to lift up your values and demand action is when someone's asking for your vote. So make sure that they're going to vote based on what they say they're willing to do.
Perfect words to close with. Thank you. Thank you for your prophetic voice and for building a table that brings many more people into decision making and that's shaping our democracy and our world for a more just future.
It is my pleasure to always follow you, Michelle Nunn, wherever you go.